Bipolar affective disorder is a severe and persistent mental illness that often goes misdiagnosed. It's most known for the way it affects people's moods. It often creates an uncontrollable change in moods that can impact the daily lives of over 4% of Americans with this condition. Even though the exact cause of bipolar disorder is not known, studies indicate that bipolar disorder has a significant genetic component. First-degree relatives of a person suffering with bipolar disorder are 7 times more likely to develop it. Hormonal imbalances and a number of neurotransmitters have also been linked as well. In some instances, it is believed that environmental factors may exacerbate an underlying genetic predisposition. Because of the nature of their work, some individuals have periods of high demand followed by periods of few obligations. An example of this would be a landscaper who was busy during spring, summer, and fall, and then inactive during winter. As a result, the landscaper appeared manic for the first 3 seasons of business, and then depressive during winter. Bipolar is not a single diagnosis, but there are different spectrums and categories within this disorder that need to be discussed with a healthcare provider. Bipolar affective disorder is characterized by periods of deep, prolonged, and profound depression that alternate with periods of excessively elevated moods known as mania. These symptoms include grandiosity, diminished need for sleep, excessive talking or pressured speech, racing thoughts or flight of ideas, clear evidence of distractibility, increased level of goal-focused activity at home, at work, or sexually, excessive pleasurable activities, often with painful consequences. Major depressive episodes are characterized as a depressed mood, marked pleasure or interest in nearly all activities, significant weight loss, insomnia, loss of energy, feelings of worthlessness or guilt, decreased concentration, and preoccupation with death or suicide. There are effective treatments for bipolar, and medications are vital. Individuals often require multiple medications. There may be times when anti-anxiety and antipsychotics may be used for a limited time, but mood stabilizers such as lithium are considered lifetime maintenance therapy for bipolar patients. Resources such as the Depression and Bipolar Support Alliance at dbsalliance.org, the National Alliance or Mental Illness, www.nami.org.
There is hope. Get help today.